Hey folks, Cherry here from Surgical. How are you guys? Today I decided I would do my video outside. I don't shoot usually like in studios and random places. I try to always keep it as transparent and as real with you guys as possible. So no frilly suits, no pretty bougie studios, none of that, because at the end of the day, whether we dress up or dress down, whether we wear makeup and wear wigs, or whether we go to pretty places or not, at the end of the day, when we get on that table, we don't have any of that. So I try to always tell you guys the nitty gritty. I'm a patient just like you guys. I've had several rounds, and so when I was looking for information, I jumped to YouTube and Instagram, and that's, I guess, how a lot of all of this started for me. But one of the things that I didn't find was a lot of really specific information. I would find videos about people's whole journey, and a lot of times I'd just be like, "Rah," and I would not watch the whole thing, or I'd skip through, and I'm pretty sure I would miss information that I needed. So I decided that I would make videos that would be cut up. Now, I'm going to tell you in advance, I apologize for the background noise because I am here in the residential where the recovery home is. I'm at my house right now, but I have neighbors, and I have what do you call that? A rooster behind me. So at any point in time, side noise is possible. So let's jump right into today's topic. Today's topic that I want to talk about, while I was filming today in the clinic, because I have a patient who's here for a mommy makeover, we are actually filming her entire process, her surgery, everything, right? So it's actually really, really cool. But I can't post her stuff until after she has surgery. However, in the process of filming, one of the things that came up was about the amount of time, and how she was so grateful that she was going to be staying the amount of time, and that she was surprised that so many women tried to leave early. This was something that we discussed when we got towards the consent portion of the process, right? And so one of the things that I often get asked is, how long do I have to stay? How long do I really have to stay? I mean, no, really, how long do I really have to stay? We're going to talk about that, because unfortunately, there are coordinators that will tell you 10 days. There are surgeons even that will tell you 10 days. And quite frankly, you have surgeons that will tell you 8 days. They will be okay with you leaving in a week. And the honest truth is that for those surgeons, you are just a number, and that just is what it is. And so it is very important for me and for my patients to understand the level of care, the level of aftercare, the level of expectation that is there when you go into a surgery with me, with the Surgical, or with any of our surgeons. I, as a patient, was very, very picky with myself because I have a little bit of a complicated health background. And so I was very, very, very picky about where I got surgery, who was my surgeon, and all that kind of stuff. And so I am even more, and I had a bad experience in terms of, I wasn't happy with the facility where I had my surgery. I wasn't happy with some of the aftercare that I received. I definitely wasn't happy with the recovery home where I stayed. And so there was a lot of that misinformation and a lot of stuff that happened. And so even being as picky as I was, I ended up in a bad situation, right? And so I always try to give you as much information as I can so that you guys understand what it is that you're getting involved in, and that the surgeons that I work with, no matter which one you choose, no matter whether you like their work or not, these are people that are extremely, extremely, extremely by the book. These are people that are not going to bend for a few dollars. These are people that have your best interest in mind and at heart, and obviously for your results as well. And so, the recommendations that we're going to talk about today are recommendations that I've learned from, one, having amazing surgeons on my roster, and I'm so grateful for the surgeons that have supported me from the very beginning, because I've learned so much just in conversation with them, just in learning how they deal with their patients, and being allowed into their offices, and being allowed into their practices, and seeing how they function, how they communicate with their patients, and the recovery home, and all of that stuff. And so that has allowed me to have a really inside look, and also taught me to say, no matter how big your name is, I will never work with you. So what I want to talk to you about are those recommendations that come from those good surgeons that are out here that I work with, and whose recommendations I follow for all of my patients. Okay, so let's get right to it. The first thing, we're going to talk about the 3 most common procedures right now in plastic surgery. Okay, and we're going to be talking body procedures. So we're going to be talking about lipo BBL, which is a given. It's a very, very common procedure. It's one of the most common procedures in plastic surgery, if not the most common. Second, lipo, tummy tuck, and BBL. And then we're going to talk about the variation between lipo, BBL, and breast implants, lipo, BBL, and breast lift with implants or without, as well as we're going to be discussing lipo, BBL, tummy tuck with a lift or reduction. So we're gonna dive into all of those things, and I want to make sure that you understand what the difference is, why not, blah blah blah. So the first thing is lipo BBL, right? Most girls come to get a lipo BBL. It's a liposuction, lipo 360, and a fat transfer to the gluteus. 9 times out of 10. Sometimes women say they only want it in the hips, or they only want to fill defects, or they don't want the BBL at all, which is very rare. However, there's always something that we can fix with the additional fat. And so any fat transfer that you get that's towards that area of your butt or your hips or whatever would still be considered a BBL, okay? Now, when you get a BBL done, you are going to have fluid, or when you have liposuction of any type, you're going to have fluid that's going to be introduced into your body, which means you're going to have added water into your body. This is the reason why you need to drain. This is the reason why you need to have these lymphatic drainage massages, so that you can definitely get rid of that additional fluid and not get fibrosis and not swell and all the other stuff, right? Okay, so in order for that to happen successfully, you're going to need about 12 days here in the country at minimum. People can tell you can stay 10 days, people can tell you whatever they want, but I'm telling you, you need to be here a minimum of 12 days. Why? One, you're gonna need, depending on the clinic and depending on the surgeon, and this is gonna be the same for all procedures across the board. Depending on the surgeon and depending on the facility, you may be required to come into the country 4 days prior to surgery, 7 days prior to surgery, or 48 hours. There are surgeons that require you to be in the country for 48 hours prior to allowing you to enter the operating room. Then you have surgeons that require you to have 4 days of isolation prior to being able to be seen for pre-op, prior to being able to be seen for surgery, let alone have surgery. Okay, so you have to keep that in mind, and you're going to need to check with your surgeon, whoever it is that you're going to be having surgery with. Check with your surgeon, their assistant, or your coordinator. Check in with them to find out. Don't ask on the internet. Find out how many days you need to be there beforehand, and you need to factor that into the time that you need to be here. Those days don't count towards your post-op recovery time. They don't count towards your recovery time, so you need to be clear about that. So now you've had surgery, you come out of surgery, you're going to spend the night in surgery, and the following day you start your recovery, you start your day 1 post-op, right? After operation. So the first day after, you're now getting up and you're swollen, and you're going to be transported to your recovery home or your Airbnb or wherever you've decided to receive your aftercare. At that point, you've got to consider that you're going to be receiving a massage every day, or you should be receiving a massage every single day for a minimum of 10 days before you get on the plane. Not only if you leave before that, do you run the risk of blood clots, fluid pockets, or seromas, you also run not the risk, but the very large chance of increased swelling, lots of pain, and guaranteed drop in your hemoglobin, which is not going to be where you need it to be yet. Hemoglobin raises very slowly, and for those of you that don't know, your hemoglobin is the part of your red blood cell that actually transports your oxygen. It literally transports the air that you breathe. And so if you don't have that in your system, your body's not breathing, your tissues are not breathing, things start to go haywire, okay? So again, lipo, BBL only, you're going to need to be here a minimum of 12 to 14 days, because you're going to need at least 2 days pre-op at minimum, and you're going to need to be here a minimum of 10 days post-op. So I would tell you 13 to 15 days, plan on it if you're coming here for a lipo BBL. This is an investment, you guys, and you got to understand what is expected of you. You can't come here and expect to go home looking like a Fashion Nova Barbie doll and, give it half the time. These people that you're seeing on Instagram, that you're seeing on TV, that you're seeing in magazines, they're paying a lot of money in their aftercare, and they're getting aftercare every single day. These are people that go and get massages and go and get all this stuff every single day. They're body sculpting. So you can't compare, the average Joe to somebody like that. Even me, I have to work. I work every day. You know what I'm saying? I can't be out getting massages 24 hours a day. I can't spend thousands of dollars on the aftercare. So you got to know that when, you know, it comes to what you're doing for your body, you have to make sure that you're giving it what it's worth and making sure that you're going to appreciate your investment, okay? Now, lipo, tummy tuck, BBL. You need to be in the country for a lipo, tummy tuck, BBL, a minimum of 17 days post-op. Now, I can hear Dr. Sanchez, if he's listening to my video, say 21 days, 21 days. Now, I always tell girls 17 days because 21 days sounds extremely overwhelming, but the reality of the situation is 21 days is 3 weeks. You really should be here that amount of time. I think what makes it more of an anxiety period for girls is the fact that you are away from home, which is why I stress having a good relationship with your coordinators, with your recovery home, you know, making sure that you have that type of comfort because you're going to be away for a while in your most vulnerable state and alone 99% of the time. So 21 days is the suggested amount of time on average across most surgeons. There are some surgeons that require you to stay a little bit longer just because they're a little bit more picky, they're a little bit more specific about their work, and they want you to stay a little bit longer. You know, they like to see you a little longer, but that's something that you'd have to discuss with your surgeon. And so at the end of the day, when you're talking about lipo, tummy tuck, BBL, you're looking at minimum 17 days. And why is that? Because again, you've lost blood in surgery, you're still full of fluid, you're still swollen, you have an incision. Now this incision is a hip to hip incision. And so you have this big incision in your belly. It's in the middle of your core. It is still super soft. Okay, still super soft. And I want you to equate this to like if you had a cut, but like a really bad cut, and it was split open and it started to heal, right? Imagine putting pressure behind it. It will start to open up on you, right? You ever have a chapped lip and feel that shit split open like that on you? That's what I'm talking about. And so your incision, what ends up happening with your incision and the pressure from the cabin of the airplane, it will cause your incision to open. It will cause your incision to have too much pressure on the back end of it, and it can cause the skin to open. You don't want that to happen. If that happens, you're going to have a problem. You're going to have an issue, okay? Please, if you end up back in the United States and you have open incisions, or you end up with surgical wounds, you end up with problems, you're not going to be able to get the type of medical care that you are expecting because nobody's going to want to touch it. They're not going to want to be liable for whatever you have going on, and so they're going to send you back to the surgeon or a surgery center where you've had your procedures done. And so this is something you want to really keep in mind. This is the same time frame that goes for lipo, tummy tuck, BBL with breast implants or breast lift particularly. There's a lot of cutting of tissue, a lot of cutting of, you know, when you're doing a breast lift, you know, you're cutting under here, you're cutting this way, you know, you're cutting a lot of different things on the breast, then you're cutting the abdomen, then you're still doing lipo in the back, and you're doing lipo in the waist, and it's a lot of destroyed tissue. It's a lot of damage to the body, you know. And so you've got to give yourself the opportunity to heal, to establish those roadways, those vascular roadways where you're going to have healthy blood supply to your tissues and to the rest of your body, where you're going to be able to transport good amounts of oxygen because your hemoglobin has been restored. You want to make sure that you don't have this fluid stuck in this extracellular space. You don't want to have fluid stuck between your skin and your muscle. You know, you end up with skin and, you know, this area swelling in here, and you can't get it out. And what happens? The more time that goes by, it becomes hard. It becomes like jello. It becomes these like rock-like things, and it becomes really difficult to have taken out. You can, you know, massage them down. It's quite painful. If not, you can have these injections done that help to, you know, break them up. But really, at the end of the day, fibrosis becomes scar tissue, you know, and you need to make sure that you avoid all of that because it's going to ruin your results, okay? Now, I know that girls are not a fan of staying away from home for so long, but again, I need you guys to understand, like today, Doc said it in pre-op, and I tell my girls this all the time. We are a team. We are a team. He does his part in the operating room. You do your part in recovery, and we do our part along in recovery with you, right? So making sure that you're prepared, making sure that you know what's going on, making sure that you know how to take care of yourself, how long to stay. You know, and during your stay, if your stay is long enough, we're able to prepare you. We're able to teach you. Day 1, day 2, day 3, you're not able to put your faja on by yourself. Day 7, you're not able to put your faja on by yourself. So you got to understand that if we're asking you to stay longer, it's for your own good. It's not because, you know, you should be staying 3 months. That's a little too much. You understand what I'm saying? But there's definitely safety parameters that are there, and they're there to ensure, 1, your safety, and 2, to ensure your results. And so if you're going to spend the money, if you're going to save and spend $10,000, $11,000, $12,000, $15,000 over the course of a year between surgery supplies, aftercare maintenance, you know, massages, fajas, creams, medications, everything. If you're gonna spend that money, right? Make sure that you're prepared. Make sure that you are going to do the right things for yourself. Make sure that it's not in vain. It's a lot of money. You know, at the end of the day, it's not a cheap habit, you know. And it's not that people that aren't rich can't afford it. They save their money. They work really hard and they save their money. And that's why I'm saying, if you work really hard and you save your money, don't throw your money away. Don't just, oh, well, I can. No. You understand? You deserve to have the best results potentially possible, but you also have to do your part. So with that, I'm going to leave you. If you guys have any questions, make sure that you comment below. Also, make sure that you like the video, subscribe to the video, share the video with your friends. We really are looking for more volume. We're looking for more customers. We want to take care of more girls like you. Right now, we're a little bit slow for the month of February. So if anybody's interested in coming out in February, let us know. Otherwise, March, we're sold out. April, we're looking pretty packed as well. So just hit me up though. I always try to make time to make sure that I'm available. So we have WhatsApp, Instagram, everything. So follow us on Instagram. Make sure you follow the page, subscribe, all of that, and I will be around. I'll be back with more videos soon. Okay, take care, you guys.